Welcome to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today is a return guest, my friend Dr. Girma Tefera, and Dr. Tefera is the Medical Director of Operation Giving Back at the American College of Surgeons, and as his day job, of course, is a vascular surgeon at the University of Wisconsin. Welcome, Dr. Tefera.
Thank you, Dr. Wexner.
Always good to see you, and I'm always impressed to learn more about Operation Giving Back. I remember in my days as a fellow before I was a governor, serving in the very early stages of the project, and under your leadership, it has blossomed multifold. Perhaps you could recount for our viewers a little bit of that history of OGB, how we got to where we are today.
Yes, of course. And thank you for having me back. And also thank you for the opportunity to tell our members a little bit about Operation Giving Back. The program started back in around 2004, actually, as founded then. And at that time, it was actually in response to a survey that was done between 2002 and 2003 to understand the amount of volunteerism and humanitarian work our fellows are doing, and at which time actually through the Board of Governors, and at that time I think Dr. Andrew Washoe was the lead person to get this started. It was very clear that overwhelmingly our members wanted a program that could support them in their humanitarian and volunteerism work. And that's really what led to the creation of Operation Giving Back, to be like the resource center, if you will, for fellow members who want to volunteer and provide humanitarian work across the globe, including here in the US, of course.
And at what point after 2004 did we transition to having an office with you as medical director?
Yeah, so the founding medical director is Kathleen Casey, who really ran, amazingly well the program from early on for about 10 years or so. And I transitioned into this position in 2015, and I've been in this position since then.
Thank you very much for that history. And I guess my memory is jogging. If it was 2004, it probably was the governor's committee at that time. At what point did the college establish a formal office as opposed to a committee?
It's actually right after 2004, the office was established, and the first medical director, who did really a superb job for 10 years almost to follow, was Kathleen Casey. And subsequently, after 10 years, I am basically the second medical director that took this job back in 2015. And the office had always a director and also a program coordinator.
I remember serving under her, probably would have been around 2004, and I obviously benefited, we all have, from your leadership since then, since that time. And one of the things I remember from being on the committee back at the beginning was the incredible volume of amazing applications we received for both domestic and overseas work. And for those people who haven't been privy to that very, very difficult decision-making process, because there's so many very well qualified applicants or nominees rather every year, can you give us some idea of the demographics, how many people are nominated, and how you decide between overseas work and domestic work?
Oh yes, and you're right. The work group that really chooses these award winners for the Pfizer ACS awards for volunteerism and humanitarian work, they don't have an easy job. My office is just to support, provide that access for the documents for them to review and to cheer them up. And I'm so happy I'm not part of the decision makers. In general, there are somewhere between 40 to 60 applications that we receive of all types. And I say all types because we have so many different categories. And if you allow me, I can just list them up quickly so that people can know. One is the Residence Award. The second one is what we call the Humanitarian Award. And the Humanitarian Award is an individual that is has dedicated significant amount of his life, if you will. And that becomes his or her job. And that's in the humanitarian category. Whereas the volunteerism part is, are individuals that fit actually most of the applications, if you will, are people who are doing some part of their professional career. However, they have, of course, if, as you said earlier, a day job. And then we have the military category for those who are in the service, but who are providing beyond their call or duty, going beyond that and providing some assistance in volunteerism. And the last one that we have added this year is we are seeing increasing number of younger surgeons who are in academic institutions who are really being involved and engaged in academic global surgery work, which translates into all the things that academic global surgery brings with it: education, research, teaching, and so on and so forth. So we have all those categories, and in general, 40 to 50 to 60 people are nominated.
We recently had the award ceremony, and maybe you can give us just a brief thumbnail of some of the incredible things that the 5 awardees did to deserve their recognition this year.
Yeah, so this year we have 5 incredible award winners, and they are, as you saw, from different specialties, different locations. One of them, who is actually an international fellow from Taiwan, and Dr. Zhang has really dedicated a lot of volunteer work in Vietnam. And he started initially as a mission trip, but he realized this was not going to be enough. And so he ended up not only initially increasing the amount of mission trips, but he subsequently ended up creating a situation where bilateral exchanges could happen so that you could actually start training and making those individuals independent in their own country to do the things he has been doing. And so he's really scaled it up. There are 4 other individuals, and one of the domestic volunteerism is always a challenging piece, right? So because there are a lot of if you will, rules and regulations that really make it hard in the US to provide free service in general. But the award winner that we have this year is Dr. Dicker. She is a trauma and critical care physician. She has been really doing amazing job, real public health approach to violence and and post-violence engagement with populations that are being caught in this, be it gun violence or others. And there was a lot of dedicated time and long record of experiences that really have improved people's lives. And she really has done an outstanding job. And I encourage everybody to kind of listen a little bit to the lecture that she has provided actually at one of the panels. We have another surgeon who is an oncologic surgeon. And he is from a university, and he's a teacher, and he has developed what we call a typical academic program in India. And he is originally from India. He has been engaged in training people at the University of Nebraska Medical Center, and he has actually been also involved in traveling and developing programs. And that is Dr. Ari. His engagement and change he has brought in his native nation, India, is just incredible, and a lot of years spent. He has internationalized it, actually. He has founded multiple consortia to come together and provide cancer care. Another amazing volunteer awardee is an ENT surgeon from North Carolina, and that's Dr. Senior. And he has done similar to Dr. Jiang. So basically a sustainable, process-oriented training to really bring in his expertise and teach over the years in Southeast Asia, in Latin America, multiple mission trips, but most importantly, teaching. Um, and what is exciting at the end of all this is we have also the upcoming residents. And this year we have also a phenomenal resident that has been awarded for his work that it looks like he must have started doing really very early, because as a resident, he has already been so much engaged and involved, and his name is Dr. Kantar, and he's a resident in Baltimore. So these are all individuals that when you read what they have done, it's very humbling, and I hope our fellows will tune in, to listen to the recordings that have already been done if they missed the sessions. And thank you for trying to highlight their achievements in this session.
Well, it's my pleasure and privilege to be able to highlight those achievements and the work you and the rest of your department do to get everybody in this program organized, to be able to recognize these wonderful humanitarians who go way above and beyond to provide service, as you say, sustainable service around the world. I congratulate each of them for their achievements. I thank you for what you do for the college, and I thank you also for your time today. Always good to see you, and I think it's been almost 2 years since it's in person, so hopefully again soon in person.
The same here, and thank you today for the opportunity.